You're listening to the ReThink Health podcast, hosted by Dr. Marius Geanta and powered by the Center for Innovation in Medicine, a European research and innovation organization. Through this podcast and the ideas expressed by our guests, we want to build forward better and to set the stage for the European Health Union, one in which the Eastern voice is also heard.
So, welcome everybody to the ReThink Health podcast. My name is Marius Geanta. I'm the founder and president of the Center for Innovation in Medicine. And it's a very big pleasure for me to introduce our special guest of today, who is Brian O'Connor. Is the head of the European Connected Health Alliance and a very good friend of us for many years. Hello, Brian.
Hello.
Very good to
nice to see you again.
To be with us today. I will begin our conversation by asking you about the European Connected Health Alliance, because if you enter to your website, you can read that you act in 78 countries and you cover more than 4 billion people. So it's a huge organization. And tell us more about your activities, your objectives.
Well, thank you. It's a pleasure to be with you. What I would say is this, that just to give your listeners and viewers a background, the reason I started the European Connected Health Alliance some 10 years ago now is that I was frustrated by the fact that our sector, or sectors, digital health and care sector especially, has got so many silos in it. And people who should know each other know of each other. They do not know each other. And therefore, as you and I have met many times in Romania and so on, Marius, it is because of personal contact and follow-up that we started to build and break down these silos, because they restrict innovation, they restrict ability to communicate with your peers, to learn, to advise and hopefully teach. And as a result, in setting this up, I remember I set it up because I was retiring at the time. I'm now in my 4th retirement, I should explain. And I've realized now there's no point in trying anymore. So I just thought I'd better do something. And what I realized was, if someone could solve the problem of connecting people and breaking down silos, you could do some good across our sector and our community, and eventually, of course, to citizens across Europe. I have to tell you as well that it's been 2 things. One, really hard work. Second, it's been great fun as well. There are more days of fun, perhaps, than hard work, but a frustration, I suppose, that I just cannot believe how many people know of each other, as I said earlier. Example, I remember when we used to have physical conferences, we're now getting back to those in person. I remember meeting a professor I knew really well from a brilliant university in Scandinavia. I won't say who, won't embarrass her. So we're chatting. Another lady walked by and I said, "Oh, you two must know each other." Why would we know each other? Well, because first of all, you're both from that country. Second, you're both from that university, right? Next, you're both from that campus, same campus, and you're in the same building. You're on the 5th floor, you're on the 4th floor. And the girl said, "Oh, I know you," she said. "You've written so many good papers," she said to her colleague. And I said, "So you know what each other is doing, but you've never met. Why don't you have a cup of coffee sometime? Why don't you walk down or up between the floors?" I'm pleased to say they're now great friends, great colleagues, and they write joint papers together. But there's an example of where people assume that they know what's going on, when in fact they don't. So I decided to do something about it. And the only way to do it is to have a structure and a network which allows people to do that. And that's why we've built over with many great friends of mine, including my brother Damien, who you may remember. We've managed to build a global community now. So my ambitions for Europe have been far exceeded now by a global community. But the principles are still the same, still connecting people to each other, letting them talk to each other and know what each other's doing, and then saying, how can I connect the dots? There are always dots, as you and I know. There's always our dots that you can work together on. And then that creates a solid foundation for innovation and for progress.
I think the key word for you and for the European Connected Health Alliance
Yeah.
is connected, right?
Correct.
And I'm very happy to see listening to you that you make a difference between being connected and being connected in a digital way.
Yes.
Because your example with the two professors from the same country that actually didn't meet each other in person,
Yes.
it's a very good example on how important is the interaction between individuals, mediated or not by the digital tools.
Correct. That is correct.
I think it's very important to set this from the beginning, because the Connected Health Alliance is not just about digital. It's about putting people together.
Yeah, I think that's the foundation of everything in the world. I mean, that's us as human beings. We work on the basis of connecting or not connecting, as the case may be. But what I think is really important, maybe to stress, Marius, it's not just having an idea and saying, wouldn't it be great if everyone spoke to each other, were connected and did something together? You also have to provide the infrastructure for people to do that. I mean, when we think of it like this, in any country, you always think about where are the roads, the bridges, the tunnels, the railways, the airports, the ports. If you look at our digital world, all too often, a component, it may be a part of a road or the concrete to make the road, may be available in a particular company or organization. The problem is if that company does not talk to the next one and get into a supply chain, for example, in that case, then nothing much happens. So we're in the position of being effectively, as you say, the connector. We literally join the dots, we connect those dots. And as a result, you have a foundation which is easy to plug into. And the last thing I'll say on that is that it's really important as well for us to understand that there are so many good things happening around the world. You first find this as well. Around the world, I keep meeting people who talk about innovation, who do innovation as opposed to just talk about it. Because again, there's a lot of talk, and I prefer we all do action, real action. And what's fascinating for me is that I have no worries about whether there's going to be innovations to solve the various problems. I don't think that's a big problem, because I think there's so many people doing various things. The difficulty, as I said earlier, is too many of them do them in a silo. They don't see the bigger picture. And even if they want to see the bigger picture, they don't necessarily know who to talk to, who to connect with. So we spend, frankly, all our time connecting those dots across the world. And it is honestly so heartwarming and exciting to see real things happening, not because we have done a great deal, but because we have made the initial connecting of the dots. And then you see things blossoming from that. So I think organizations like ourselves are important in at least beginning the journey for people and fulfilling their dreams of being connected. I mean, you do it all the time. I can see in what you do as well. So we're similar people, I'm afraid.
Indeed, you mentioned a buzzword, innovation, and
yes.
I would like to find your perspective on innovation and the use of digital tools. Because usually people, referring to innovation, they tend to overlap to say that actually digital is innovation. What's your opinion on this? Your comment?
If I can answer by saying this, I was asked the other day how many management advice books I've read, all of the great books around that tell you how to manage things and talking about all the great books on innovation. And I'm often asked, should I write a book on innovation? And the answer is no, I'm not going to write a book because I don't have the time and I'm not really that interested. Because many of those books, though they're good, are theoretical. There's a book recently published on digital health, for example, by a great friend of ours, one of our colleagues, Professor Rahendra Gupta from India. And he has spent years looking at how innovation works, doesn't work, and particularly in the digital field, how it can be accelerated. And he has a more practical approach to innovation. So I don't want to get into what is innovation as opposed to digital. I think actually that I would use different words. I would say there has to be a need You have to identify a need first before you start coming up with a solution. I mentor a number of companies personally, just for fun. And they always say the same thing. I've got the best thing in the world. Good for you. Is anybody else doing this? No one else is doing this. I'm the only person in the world doing it. Well, we've been around long enough to know that just simply cannot be true. Someone somewhere has already either done it or is further ahead or is doing exactly the same thing. So again, the connecting of the dots helps when you can compare and contrast. What I would say is when you've identified a need, you then have to find solutions that fill that need. Too many digital solutions are created because it's a good idea. However, they don't think through and say, well, just because it's a good idea does not mean it's going to work. It doesn't mean it's going to be acceptable. It's going to be accepted in the community. People are not going to buy it. Because it's the best thing to do, you can do it 3 seconds faster or something, is not necessarily, from a business point of view, the selling point. The selling point for me is, we do this all the time, lead with the need. That's what we start with. What is your need? And it's amazing how few people understand and can tell you what their need actually is. Then you say, okay, now I know your need. I had a private roundtable yesterday with 20 different companies. And I kept saying to them, tell me what your need you're trying to address. And only 4 of them were able to tell me succinctly. So the purpose is identify the need, spend time on understanding that, then go away and find the solutions. Now, digital has incredible advantages, as you can gather. And we've seen those particularly played out during the COVID pandemic. As the Chinese always say, wei jie, they always say, which is every crisis is an opportunity. And in the case of the crisis of the pandemic, and now more recently, the crisis of Ukraine, that identifies the need for you almost. Then what you have to do is say, does anybody have a solution? And what amazed me during the pandemic was not so much the innovations. I mean, I think there were innovations in quicker drug and vaccine approvals and so on. I think that was brilliant. However, the number of what I would call almost existing solutions, which have never been able to be sold, where had the dust taken away from them and they were presented as solutions. Quick example. Stories are always better, I think. Scotland were looking for a telehealth solution for a number of years. They decided to have a pilot run at this because you remember, you have to convince so many people that telehealth is good, as it's just one example. In one of our other ecosystems, which was in Melbourne, Australia, you couldn't get much further away. They've been using the telehealth solution there by the government and others for many, many years. We introduced, literally at the beginning of the pandemic, our ecosystem in Melbourne to our ecosystem in Scotland. As a result, the Scottish government made a quick decision to buy that Australian telehealth system. As a result, forget about pilots. It just was put into action immediately. And as a result, it's now become part of what they offer in Scotland, as well as personal visits, doctors. There's an example where you didn't need to innovate. The innovation was not in the equipment or the algorithms or anything like that. It was in the connecting of people and making sure that that solution was known in Scotland. Now, so innovation takes many different forms. And I think we're very lucky to live as we do in a digital age. I really do. And you've seen it in the work that you do, that once you've identified that need, you should publicly ask, are there any solutions out there? You don't have to go and invent them all yourself. You really don't. And too many people try to do it. I remember working for a university in my home country of Northern Ireland once. And I realized that everybody in that university was quite brilliant and they produced some amazing stuff. When I did a short survey, I found that only 10% of their innovations, as they call them, ever reached the market. 2 reasons for that. One, they didn't know how to get it to market. So we set up a commercial in-house entity to help them. But the other thing was the mentality of some of the academics. They were saying, it's not perfect yet, Brian. And I said, hold on. It's 80% of the way there. Would you agree? Yes, but I've got to get the other 20%. Now, you know the rule. 80-20. If you keep trying to get the final 20% to be perfect, it never happens. So I said, why don't you give me the 80% one? I'll go and sell 1 million of those for you. That'll give you the cash and the time to go after the next 20%. And I think those are, I know I'm being, I'm trying to be practical in this conversation, because I think practicality is what people are looking for. We've all got the theories, we've all got the books, we've all got the high-powered conferences, and you need those as well. They're part of the ecosystem, but you need to be practical. And people, innovators are not the problem. There will always be lots of them. And I encourage them enormously, as you know, with the work we do. But I think you need to be practical in deciding and finding the need, then finding the solutions, and then connecting the dots. And it works. We have many examples of that in the Alliance. May not be a good answer to your question, but that's my answer.
No, I fully agree that the practicality is very important, and you don't have to reinvent the wheel all the time.
Correct.
As you said, it's important first to identify the need and then to ask. Anybody has a solution for that need. If not, okay, we can move to research and innovation and
correct,
and so on and so forth.
Correct.
So I fully agree. But I will stay a bit on this, let's say, practicality, because this involves people, that, yes. And you mentioned the example in Scotland,
yes.
with the telemedicine system,
yes.
From Australia, and was successful in Scotland. But the question is, why the Scottish people didn't implement the system before the pandemic, 5 years ago, 10 years ago? In other words, how important and how do you manage the behavior, the individual behavior of the people, especially medical doctors? We know the inertia. I'm a medical doctor, so yes. I'm qualified to discuss about this. How do you see this point of changing the behavior when it comes to to innovation, to new things?
You've hit on probably one of the most, if not the most important aspect of innovation. Because everybody jumps and said an innovation must be a new, good, brilliant idea. The reality is the obstacles to even talking about a solution start when you realize the number of people involved, for example, in a government who make decisions. My experience is there are too many of them. That's the first thing. Because the Department of Health in any country has only got a limited budget for innovation. Why? Because they're under so much pressure to put as much money as possible on the front line. And you only get to look at the pandemic. It illustrated how ill-prepared we are in Europe. Just take Europe as an example, to look after citizens. There were waiting lists before the pandemic in every country. There are waiting lists, even greater waiting lists after the pandemic. And to some extent, I feel that the pandemic has been used as an excuse or a reason why the waiting lists have gone up. The fact is they were always there. They've grown bigger. And still you find people having to wait for 12, 15 hours for an A&E, emergency department even. So you have to understand, you have to take the time to understand the process that people go through. Civil servants are everywhere, and many of them do a brilliant job. However, the process, for example, of procurement can be either the biggest obstacle to implementing innovation, or it can be the biggest help to implementing it. A crisis like the pandemic forced procurement departments to set aside most of their rules, especially the rule that you and I have encountered too many times, which is what I call pilot-itis. Too many pilots. How many more times do you have to prove that this works, right? Because it's got to go to another level. And we've all been through that. And eventually you get to the stage you think, oh, this is just not worth it. During the pandemic, many of those rules were set aside. And as a result, innovation really pushed into the system and made a difference to people's lives, literally their lives, and staying alive, and to their ability to recover quickly. I have a slight concern that some governments, thinking the pandemic is over, which I don't think it is, are now saying we've got to live with it. That sounds really nice. However, we'll go back to the way we used to do before, go through all these different steps of procurement. So what we have done as the Alliance is to go to procurement departments, and have done for the last 10 years, and included them in the process. Because too often they are seen as remote, not connected. Because when you go to certain, I won't name the country again because I don't want to embarrass people, but I went to one particular procurement department. They were shocked, first of all, I wanted to meet them. But you're doing all this with companies and with, and I said, wait a minute. If you don't approve these things, they're never going to get into the health system. So I want to understand why, how do you think, how do you work? And of course, they're very risk averse. They're trying very hard to protect the public and citizens against any, crazy ideas. Within that process, it's been built up over many years. And what tends to happen, is it becomes the only way to do things is this way. So what I would say to you is, you need to understand what each part of the overall approval system works and doesn't work, understand what the rules are. And what we have found is, interesting enough, you can persuade procurement people to consider changing the rules as long as they understand the purpose of it. So they should not be regarded as the enemy. They should be regarded as friends, because they sometimes don't have a broader view of the outside world. Because tell you one of the last thing I'll say on that, many of them are worried if they issue a tender for something and no one responds, that's regarded as a total failure. Why does that happen? It happens more than you might think. It happens because they've asked for the wrong thing. They've asked for the wrong solution. Why? Because that was the one they asked for 3 years ago, and it's safe to go again. What we try to do is help educate them as to the solutions that are available on the market, especially digital solutions. And they go, wow. So if they rate a tender, which is too narrow, I may have a great solution, but it doesn't fit. So I think it is not easy to break through the system in any country. And procurement is a key department that should be listened to, understand their psyche and their thing, and also they're open to be educated on what's available, and that assists them as well. So it's not no one answer on it, I'm afraid. It's a really complex, difficult issue, but I can tell you it is capable of being solved. We have done it with help from many people in many countries.
I'll try to challenge you, starting from what you very nicely described about the procurement. And, the European Commission did a very good job in terms of vaccine procurement.
Yes.
And was, for the first time, access in same day to all the citizens, without waiting for 2 or 3 years.
Correct.
It is the
Correct.
case for cancer patients from Romania and other countries and so on. But now, 1 and 3 months after, we see that actually, the vaccination rates are low in this part of Europe, are higher in the Denmark and Western countries. So is the society. It's a matter of individual behavior of the citizens. And I will try to link this with your project, Digital Health Society. 5 years ago, in the context of the Estonian presidency of the council. And I enjoy a lot because it was for the first time when somebody put in the hands of citizens, the data and then the digital tools.
Yes.
And how do you see actually now, after 5 years, with having in mind the pandemic and maybe this example of vaccination, and how people behave when they have to make a decision in relation to an innovation?
Yes.
How do you see now the role of citizen, the engagement of the citizen, the work with citizen in terms or in order to improve the access to innovation, to change, to connect in a better way?
You're very good at asking very big questions. So I'll do my best in a short time to give you my view. I think, first of all, we should be proud of what was achieved during the pandemic in terms of reaction, not just in vaccines, but in many other ways. We should build on that genuine experience to keep the momentum going. There is a tendency, as you will well know, that as things appear to get easier, right, people then, including citizens, back off and say, well, the pandemic's over, or I'll only get a cold, or. The reality is that we must use the current crisis, which some people think is going away, to use as an example of what can be done. Again, let me give an example. I was in Ireland recently, the Republic of Ireland recently, with a great innovator, Martin Curley, within the health service executive there. And what he has done is use the pandemic experience in Ireland, which was dreadful for everyone. I mean, citizens, people dying, and we all had a sense of doom approaching it. He has kept that, let's call it, ecosystem together from every sector of every aspect of our sector. He has made sure they continue to meet on a regular basis, saying, right, we've helped deal with that. We're still dealing with it. What else can we do now, for example, to take the next big problem? Let's call it waiting lists. Take Ireland as well in terms of linking it to Ukraine. Ireland, like many European countries, have opened their doors to Ukrainians, quite rightly, in my opinion. And as a result, they know they're going to have additional 200,000-300,000 Ukrainians in a country with 5.5 million people, right? And that, of course, you then say, well, how's the education system going to cope? How's the health system going to cope? So in addition to all the other problems, but the great thing is when you know what the problem is, go back to what I said about the need. When you know what the need is or the problem is, you at least have an objective. You at least can quantify it. You can at least say, this is impossible, or no, I can't solve it completely, but I can do the following 5 things. And what I think you're finding now is there is a determination on the part of many people, including the Digital Health Society, not to give up, not to think the job is done, not just in the pandemic, but on data. Data is another example, COVID passports. When you look at what happened during the pandemic on, well, let's call them passports for the ease of words. The eHealth network, which has existed for many years, incorporating every country in Europe, has kept a low profile. It was moving along doing good things, but not spectacularly good things. I hope they don't mind me saying that, but I think that's true. What actually happened was that became an amazing, innovative network during the pandemic. And rules which said, no, we can't transfer data from this country to that country, or can't do this, can't do that, were faced full on and said, we have a problem. There's the need. What is the solution? And as a result of literally a crisis on them, they stepped up and created within the rules, but people being flexible about the rules in different countries, and brought all those countries together to enable people to have information transferred. That particular one is not dead by any means. It's actually continuing. And the Digital Health Society this last week or so have announced that they're going to pick this up as one of their key topics for the next 12 months of roundtables, where we have experts from around Europe and elsewhere talking about how can we turn that example of a solution in a crisis into permanent. So because on top of the vaccination certificate, it can become a permanent, not just vaccination certificate, but information and patient record. And you know how long everybody's been working on trying to get transportable records. We know that. I mean, I work with Catherine Kronacki and people like that. We've been doing this for years. This has given us a solution. Why wouldn't you turn that vaccination certificate thing into a permanent health passport? I'm not saying it's easy. I know there'll be people object to it, but it worked during the pandemic and is still available. Why would you throw away an innovation like that? So I think I am much more optimistic, Marius, that people have learned a lot during this crisis, and they are determined not to go back to where we were, because it's not just we didn't think of it just as pre-COVID. We should think about the mess we were in before COVID on health in general, and in cancer, where you're very involved in, especially. So I think the lesson there was an innovation, a passport, a willingness to work together, and saying, I know we've got obstacles, let's get them out of the way. That's a different mentality from the past. And I think there's a real chance that that'll continue. We all have our part to play in it, though. We can't just say, I'm sure they'll sort it out. Because I smile when people say that. We each have, I really feel this, a genuine responsibility as human beings to help each other. And we can all help in different ways. You've got great skills and well known in the fields you're in. You are obviously helping, but you need to bring people with you. And you can't pause. There's no rest, I'm afraid, for you. You're going to have to keep working as hard as you always worked. And so am I.
Indeed, and your example on the ECHAlliance network, who for many years was, quiet or under the radar, and
yes.
now actually facing a big challenge like the pandemic.
Correct.
They have been in the position to deliver something very good.
Absolutely.
And it is the case for many European Commission services. And I have in mind the steering group for prevention and the promotion of the health, who now with the cancer, you mentioned the cancer topic, but other NCDs is become very active.
Yes.
Is something new as well for them. Is something that probably they need help. Because actually over the night they have on the table the cancer topic, the COVID topic, the cardiovascular diseases, the diabetes, and other chronic diseases. So it's difficult to deal with all of them, having requests from all the stakeholders.
Yes.
So I'm very happy that you put this and explain how actually the European institutions change the way they behave and act. And yes, we should not let them come back to the old normal.
Correct.
As some of them said. And for the end of our discussion, I'd like to ask you, Brian, because you European Connected Health Alliance react to the Ukraine war. Tell us a few words about the Ukraine Health Connector. Again, Connector. Okay.
I think. As we said earlier, and it ties in what we talked about earlier, I actually believe each of us on a human level, forget about organization level, have to look and decide who we are and what we can do about anything, any particular crisis, like we did with the pandemic. When I looked and heard about Ukraine, I mean, horrified by and even more horrified every day as I see these horrors unfolding on the streets of some of those cities. And you sit back and you think, well, should I just give some money? And that's good. But all too often, that's all anyone does. It's much easier to send money than doing something else. So send money and do something is my attitude. I then looked at what assets I've got some influence on, and that is, of course, the connector. And I thought, we can't just stand by. We have to do something. So by creating the Ukraine Health Connector, we gave a forum and an ability for people to tell us what they were doing. And many, many people are doing fantastic work, really fantastic work. But very often, again, the same thing applies. They're doing it in a siloed approach, not deliberately, but they're doing it in an emergency to get something done. Our skill is being able to connect those dots. For example, our ecosystems and people in Estonia are now teaching children in Ukraine remotely in the Russian and Ukrainian languages, whichever is appropriate, depending where you are in Ukraine. These are practical things again. I go back to the practicality. We then I talked last Saturday morning, it was, to the Ministry of Health in Ukraine, in Kyiv, and said, what is it you need? Go back to my thing. Tell me what the need is. And this week we are publishing some of the needs laid out by the official Ministry of Health. That will continue, unfortunately, as the war will for some time, I think. And therefore, we have to realize it is not a crisis that's gone away. 2 minutes, some people think, oh, it's quietening down. It is not. Therefore, the need is still there. And also the need to rebuild Ukraine afterwards is still there. So I think you have to decide what role you can play. We have always played the role of connector anyway. So on a regular basis, we're doing Ukrainian Health Connector updates. We're connecting the dots between organizations, working with the World Health Organization, for example. They're doing a great job, one, on raising money, and B, on the practical, on the ground level, and trying to connect with people in Ukraine, because believe it or not, one of our missions about 6-7 months ago was to set up an ecosystem within the ECHAlliance in Ukraine. We already have members there. And of course, we've also got members on the front line, so to speak, of Moldova, Romania, Hungary, Poland, Estonia, Latvia, Lithuania. So this is not something we can ignore or should ignore. We have real friends, colleagues, and organizations in each of those countries. Now, we're not the World Health, we're not the United Nations, but you have to do your own small piece in this horrible situation. And so we positioned ourselves as the connector, and already we can see the benefits for people physically in Ukraine and indeed the surrounding countries. And it's great to see Romania, for example, and European countries generally taking some of these people who have been traumatized, and especially the women and children. I think it's just horrific to see what's going on. So we're doing what we can do, and everyone, I would say, should be doing the same.
Yes, and it's right as well for us at the Center for Innovation in Medicine. This platform, actually, ReThink Health, wasn't possible without this context. Thank you so much, Brian O'Connell, the global connector for digital health, the big guru of digital health connectors. Thank you so much. Great honor to be with us. We'll stay in touch, and looking forward for your future activity.
Indeed, and don't stop. That's the answer. Keep going.
You listen to the ReThink Health podcast, hosted by Dr. Marius Geanta and powered by the Center for Innovation in Medicine, a European research and innovation organization with interest in visionary health policies and civil society education. Through this podcast and the ideas expressed by our guests, we want to build forward better and to set the stage for the European Health Union, one in which the Eastern voice is also heard. The war in Ukraine, overlapping with the health crisis caused by the pandemic, changed our lives overnight, once again. We are all rediscovering the fear and the uncertainties of just 2 years ago, from the first days of the pandemic. We have a health crisis, but it is completely different from the pandemic health crisis. Naturally, not only health, but individual safety, from all points of view, has become and is now our main concern. At the Center for Innovation in Medicine, we are aware not only that we have not returned to pre-pandemic normalcy, but that we have entered the new post-pandemic normalcy. We are experiencing a new reality. Science and innovation do not stop because the war has begun. And nor will we.